So this is an antibody to CD79 conjugated to calicheamycin, which is actually the same chemotherapy moiety that's contained in brentuximab. And it works as a taxane does, but with the antibody conjugated to it, it's like a Trojan horse. So it goes into the cell and then blows up the cell and kills the cell. So it's very clever chemotherapy because you're really only targeting cells that are expressing the antigen for this antibody, and you're able to spare a lot of the normal cells and thus avoid a lot of the toxicity from old-fashioned chemotherapy where you just targeted indiscriminately all growing cells and obliterated everything. So this is CD79 is highly expressed in B-cell lymphomas, B-cell non-Hodgkin lymphomas, and is not widely expressed on other normal cells. So it makes the differential expression of CD79 makes it a very nice target. This was a study that was looking at whether the 2.4 milligram dosing schedule of Polatuzumab, which was comparable to the 1.8 milligram dosing of Polatuzumab. So this study really asked two questions. It asked, was 1.8 milligrams less toxic and equally effective to 2.4? And it also asked, were 8 cycles less toxic than giving this drug for a year? And the data was interesting. So I think the data clearly showed that 1.8 and 8 cycles is less toxic than 2.4 and or giving the drug indefinitely or up to a year. With respect to peripheral neuropathy particularly, and also to cytopenias. What was also interesting is the response rates were equivalent with the 1.8 and the 2.4. However, the CR rate was much higher, was about 44% in the 2.4 and 10% in the 1.8, leading to a question of whether the CRs will impact progression-free survival. We don't know that yet. So I think but I think what clearly comes out of this abstract is that Polatuzumab is a highly effective drug and a very promising strategy, that as a single agent, the efficacy of the 2 doses are equivalent, but that you have a higher CR rate with the higher dose.